Srini is set to come. Convener Samiraj, then moderator Shashikumar is here. Then we have few topics. Everyone, please limit your subjects. I think we will start with the first speaker, Dr. Anup Chirayat. He will be talking about fixing the surgical package rates in your hospital. So these are all experienced people. They will be talking about their experience. That is more important than all theory, everything.
Good afternoon. So when you think of starting your practice, so this is one thing which you have to plan. That is how to fix your surgical tariff. So I feel there are two ways. One is the actual way, doing a costing study and analyzing that, and then based on that making your profit package. And other more simpler method probably comparing with other similar hospital packages. So when you are talking about the comparing, so if you have, when you start a practice in a place, so it may be a rural place or it may be an urban, it may be a city. So if it is a city, then there may be other hospitals in that city, which may be something having the same facilities that your hospital has, having the same ambience. Whether you are trying to reach out to the patients of the lower strata or the higher super specialty cadre. So based on that, you will be selecting those hospitals and comparing, getting the package rates of those hospitals, and then maybe based on that you can decide your. Or if there are no other similar hospitals, maybe there may be other hospitals in a similar type of city in some other district. So, and nowadays, because of this NABH, where transparency is mandatory or it is necessary, it's very easy to get all these package rates now. Previously, it used to be very difficult. You had to have a lot of espionage work and all. But now it is very simple because all hospitals display the packages very well. So, when we compare on that, and then based on that, plus or minus, you can set your package rate. So, that is a very simple and practical method because. But the better method, or the more scientific method, I would say, would be doing a costing study. But here you calculate the actual cost of your surgery based on the target that you may reach. If you have started a hospital and you say you target, I will do 50 surgeries in a month. So based or in a year, I will do 500 surgeries. So based on that target and the actual cost of of each procedure, of each surgery, so, and the amount of profit that you would expect from one surgery, based on that, you can make your package. So, when you do a costing exercise, there are like two types of costs involved. We all know that. One is the fixed cost. Fixed cost is something which you have to pay these expenses, whether you operate on one patient or you operate on 100. The rent that you pay for the building, like most of us start in leased property. And labor is a very important cost because that again, your salaries and labor, that cost will always be there, even if you operate few patients or you operate more. Electricity, your equipment, depreciation of the equipments and other support services that you have. Whereas the variable cost, of course, will depend based on the number of surgeries you do. That is the IOLs and medicines and consumables that you use. So that is going to vary depending on the number of surgeries that you do. So there is one small table which will show you how your cost, your profit will change depending on the number of surgeries that you do. For example, if you do have a cataract surgical volume of say 500 and the fixed cost per surgery comes to say 8,000 and variable cost 2,000, then the cost per cataract would be 10,000. And on top of that, if you say you want a profit of 30-40%, your cost, you can package it as 14,000. So your profit is 4,000. But if your volume say increases, say the next year increases to 1,000. So with this small increase in volume, you may not have to increase the space or you may not have to increase on your number of staff. You can still manage to with the same number of staff and the same place and same equipments. But you find here that your fixed cost per cataract comes down. It comes to half. If you increase the surgical volume by double, it comes to half, 4,000. So proportionately, your total cost per cataract comes to 6,000. And if your package rate is still 14, your profit would be almost 8,000. Similarly, as volumes increase to a particular level, after a particular level, of course, you will have to increase your space, you will have to increase your number of staff. But what is important is the optimal use of manpower as well as space And then your profitability will definitely increase. And doing a costing exercise actually is a very cumbersome process, and it's not possible for most of the time. We will have to take the help of a chartered accountant, because here you have to take into account each and everything, like right from a small thing like a wire speculum, your towel clamp, or your needles, your tooth forceps, phaco choppers, everything. And the life you have to decide of those equipment. Normally, if we say it's a life is 2 years, and based on that, we have found that in a phaco, for one case of phaco, the cost for small instruments, micro instruments, comes to 144 rupees. Consumables, similarly, you have to take the cost of all syringes and blades and caps, ringle lactates and phaco tips, right up to phaco tips, phaco sleeves, your sterilization things, consumables like ETO indicators, Y indicators. So everything this is for our hospital, for the amount of surgeries that we do. We have found that the cost comes of all these consumables comes to some 1,500 rupees per phaco surgery. Labor is the one which contributes maximum to your cost, because ours is a service industry. So we need to have a lot of staff to give a good experience to our patients, to see that there is not much of waiting time, to see that each and every patient goes happy. So we need to really invest on the labor. And right from the surgeon, the anesthesiologist, OT staff, daycare staff, optometrists who do your biometry, all those things have to be considered, your counselors, housekeeping staff. Even your insurance staff, even the salary of insurance staff will contribute to your surgery. So this will come to around 3,000. In our case, it comes to around 3,300. So which is contributes maximum to the cost of cataract surgery. So when you compute all these things together, that is your consumable surgical instruments, your calibration, your labor, manpower, equipments, your furniture, indirect depreciations. So this was all done by a chartered accountant. So in everything, the total cost of the surgery comes to around 10,700 in our case. This is for our case. For each hospital, it will be different for the number of surgeries that we do. So it comes to around 10,700. And if we package, this is for a Indian hydrophobic lens, phaco foldable. And if we have a package rate of say 15,500, then our profit is 30. When we decide that we will have a profit of 30%, then it will come to around approximately 5,000 or 4,700 is a profit. That is, this profit is before tax, because you have to pay tax on this at the end of the year. So this, whether it is 30, 25 or 40, that you have to again decide based on the charges of the other competitor hospitals, because you cannot decide just because I do 5 surgeries, I will take 60%. That is not going to work, because your patients are going to go to some other hospital. But generally in eye hospital, the revenue comes from surgeries. So it is important that while your OP and all those things may not be very high, so you should have a decent profit, keeping in mind your comparative charges of the other hospitals. So this is the way of making the surgical package, and then you can increase your profit while maintaining the same surgical package by cost containment strategies. I think every institute should have this in their DNA. It should be in the culture of the organization to reduce unnecessary costs, right from small things like switching on off the fan when you go out of the room. Not only you do it, you have to give as a role model, but you see that each and every staff in the hospital should be having that culture. That is not only for the hospital, that is also for the nation actually, where you are trying to conserve energy. So small things like that. And then manpower planning is very important. So if you are depending on the patient load, say in your daycare, if you are going to see only 10 patients and if you have 5 people looking after there, that is actually waste. So based on your workload, you should have the manpower. So that is very important, because the labor, I said, contributes maximum to the cost. Then care of equipments. A life, say you buy a automated perimeter, its life if you look after it properly with good AMC and good care, you can use it for almost 8 to 10 years. In our hospital, we are using that much. Similarly, good systems and procedures, all this will help you in the optimal use of resources, so that your cost will come down marginally, so that proportionately your profit will go up, so that you can afford to have lower surgical packages. So this is in short what I wanted to say about how to plan for your surgical package. Thank you.
Thank you, Anu. Good talk. in my private practice, I used to tell like the way to sell the package is to tell the patient whichever financially you can afford, please take it. That it really helps, and once we tell that, they feel that we are on their side. Then slowly, actually, you can, this lens is better, so something you can tell. But always when we tell that, depending on your financial thing you can do, they feel very much comfortable in there, rather than telling this is the best, if you don't do this, this is not good. Anyway, that's one thing. Anyway, excellent talk, Anup. Next is Key to Patient Counseling by Dr. Alex Baby.
At the outset, I would like to thank KSOS and Radha Manasa for giving me this opportunity. And the main objectives of counseling in eye care are to enhance the awareness about the eye disease, to market new services and products, to reach patient expectations, and most importantly, to boost up patient compliance towards surgery or treatment. So I'll be talking about cataract surgery counseling, which is the most commonly done counseling in any hospitals, which is most challenging because of multiple options involved, and if properly done, it is the most rewarding counseling. So the counseling, most important person is the counselor. He should have a basic knowledge about the eye disease, what is cataract, and other systemic disease involved, about the surgeries, the complications risk involved, type of implants, advantages and drawbacks, and costs and benefits. And the counseling should be a good listener. It should be a pleasant person and flexible. It should be empathetic to the patient and non-judgmental, not prejudiced attitude, and tolerant. And most importantly, he should have, or he or she should have a sound common sense and communication skills. So, who can be counselor? An optometrist can be counselor, ophthalmic nurse can be counselor, or they can have a trained counselor who is familiar with ophthalmic practice, or a doctor or a surgeon himself or herself can be a counselor. So, whatever said and done, it should be preferably done by a lady because of innate qualities of patients, multitasking abilities, and meticulous setup. So, what are the advantages? Like we have in our hospital, we have an optometrist as a counselor, we have trained a nurse as a counselor, and there are trained counselors who is an MSW. So, like each profession has their own advantage. Optometrist is well versed with refraction, and she knows about she do a good IOL counseling. She knows the advantages and drawbacks. And about the staff nurse, being a nurse, she knows about the surgery complication risk, and she's more empathetic with the patient. And this pre-op fitness counseling is best done by nurse. And trained counselor, they are trained for the job, so that better communication skills. They are more worried about the economics, and they will try to promote higher packages. And our ideal counselor should have all these qualities, but in practically it is difficult. So regarding the doctor counselor, there are exceptions. I make a very poor counselor. So we have no less patients. We are so egoistic, so difficult. We find it difficult to answer irrelevant and silly questions, which we think silly, not the patient. And we have to face a lot of embarrassing questions regarding cost type, which I found it difficult. And we are too much worried about the complications risk. A patient comes to you, we think about the risk and complications. So outright promises cannot be made. So let them be made by our counselors. So when a patient comes to you, you should be prepared. By the time they come to us, we know, like looking at the records, we know about the details of the patient's type of cataract, whether they have astigmatism, whether they have other ocular diseases, and details about other eye surgery. That's very important, because where it is done, and how is surgery like, and about the drug history and systemic history. And aware about the counseling room, it should be a very cozy place near to the patient waiting area. It should be comfortable. It should be good chairs, and it should be equipped with posters, models, computers, etc. And in our counselor is she's a optometrist. We have an equipment like biometry and keratometry in the counseling room itself, and immediately she will go for this scan, and that makes the counseling easy for her. And whenever we design a room, a hospital, importance should be given to the counseling room. That is very important. And